everyone. Welcome back to another episode of What's Up Wednesday. My name is Carly Burridge, and I'm the founder and owner of Gaining Health. And every Wednesday, we talk about either a recent book or a recent journal article on the topic of obesity, and we talk about how you can use this information in your clinical practice. So today we are talking about a letter to the editor that was in the July 2021 edition of the Obesity Journal. And the title of this letter was Impact of Telemedicine During the COVID-19 Pandemic on Patient Attendance. And the authors were Mohini Aras et al. And what they did is they did a comparison study of all new and follow-up visits comparing 2019 and 2020 at two large insurance-based comprehensive weight management centers. And they looked at the no-show rates between 2019 and 2020. And the two centers that they used for this were the Comprehensive Weight Control Center at Weill Cornell Medicine in New York, and the other center was the Center for Weight Management at Scripps Health in San Diego. So two large centers. And so they compared 2019 to 2020. And both of these centers switched to full telemedicine in March of 2020. So in 2019, they had a no-show rate of an average of 15.8% between the two centers. Okay, so 15.8% of people did not show up either for their new or their follow-up visits. And then they compared that to 2020 when they went to full telemedicine, and the no-show rate at that point was 11.5%. So they saw a 27.2% reduction in no-show rates. And they talk about some of the reasons behind this. And part of it might be that the COVID-19 pandemic caused people to really prioritize their health and their obesity treatment more. So that's possible. But certainly also the telemedicine component probably played a big role, simply because it removes a lot of those barriers of access to care for a lot of patients. So patients aren't having to travel, and especially when it comes to obesity medicine, there's not that many obesity medicine specialists. So oftentimes patients are having to travel an hour or more to get to us. So not having that barrier of travel is obviously a huge benefit for the patients. Another thing is people who have, family obligations or other reasons why they can't leave the house, or other things that come up last minute for work. So really, I have found this too, that switching to telemedicine really reduced the no-show rate. And in my experience, it was even more than 27% reduction. I saw almost no-shows when I switched to full-time telemedicine. So this is important for us to realize and for us to incorporate for three separate reasons. One, we know that outcomes for obesity management are improved when there's better attendance and adherence. So telemedicine can really help with that. Second of all, we already talked about some of the barriers to access of care, and telemedicine really helps to remove some of those barriers. Although, of course, access to care is still an issue with telemedicine just because of internet service and cell service that's required for these visits. So not perfect, but certainly can help remove several of those barriers. And then lastly, if you're someone who's considering starting your own obesity medicine practice or starting a new program, you really do need to take no-show rates into consideration, especially when you're developing your financial plan and your profit and loss statement. So that's really important to look at. So just knowing that in-person visits, the no-show rate is probably going to be around 16% on average is good to know and to factor in. And then also that 27% decrease in no-show rates is very financially significant over time and can really contribute to the success of your business. So as you're thinking about putting together your program and how you're going to structure it, really consider telemedicine and consider incorporating that into your program structure. And I talk about this in my book, Developing an Obesity Management Program, The Healthcare Provider's Roadmap. So for more information on how to start or optimize an obesity management program, consider checking out my book, or better yet, getting the Obesity Medicine Starter Kit, which includes the roadmap. but it also includes fully editable and customizable forms and templates that you can use for your practice and with your patients. And then it also includes a copy of the patient education manual, Losing Weight and Gaining Health. And so all of this can be found on our website at gaininghealth.com. And we also do have the free 10 essential steps for starting an obesity management program. So if nothing else, make sure you get your copy of that. Again, all of that can be found at gaininghealth.com. So that's all we have for What's Up Wednesday today. Thank you so much for your time and for checking in. And I look forward to seeing you all next week for another episode of What's Up Wednesday. Until then, take care. Bye.